So governments need new ways to influence the performance of pluralist health systems. And I'm saying human health, I think we're going to find it's even more the case in animal health. Well, what influences antibiotic use? And this is partly, I have to say, aimed at a British doctors' audience, but you know, we have doctors and donors, and now the Chinese government have spent years convincing people that they should have needles to prevent illness, and they should take antibiotics to prevent their child dying from pneumonia. And the job has been done well. And now there are very few people in the world that don't want access to those drugs when they fall ill. So we've really created a belief in the efficacy, and it's because they work. On the other hand, there's lack of access to diagnosis. So in many places, people have pushed something called syndromic treatment, which is if it looks like it's an infection, don't wait. If you can't diagnose it, treat. And actually, a lot of governments and a lot of donors have pushed training health workers to treat syndromically in a way, actually, that you wouldn't do if you had the diagnosis. So we've trained health workers to say, if there's a symptom, treat with antibiotics. Meanwhile, there are incentives that encourage them to sell drugs and make a profit, and their suppliers of drugs obviously have an interest in encouraging their use. Producers and distributors of drugs actively build markets, and now there are multiple sources of information and advice, both to the producers and users, about when to use it. The point about it is, and we would say this at a STEPS meeting, interventions need to be informed by a systems perspective. Any one act is unlikely to have the impact you want. Now, one of the issues here and why this is such a difficult problem is there's a tension. On the one hand, almost everyone in the world now wants antibiotics if they feel they need it. And certainly in China and in many countries, it's basically seen as a right, an entitlement, something that governments can't take away from people. It is a very powerful drug. People want it. On the other hand, the efficacy of these chemicals is a global public good, because if they're used too much, if we use them inappropriately, we know eventually there will be resistance, but it'll happen faster. So on the one hand, globally there's a right to access, but on the other hand, we want people to limit their access for the public good. So the point is, measures to slow the emergence of resistance must recognize the right of access, and they must include interventions to increase access to appropriate antibiotics if they're going to get political support. And I have to say, I'm talking about human health, but I think farmers think the same way. So who is government to deny people access to these drugs? Just a couple thoughts about what a systems approach might look like, and I think this is the last slide. So we explicitly put these words in. It's towards the sustainable, and that means we have to understand resistance, and just use of antibiotics, which means we have to recognize the right of access. What might this look like? Well, first of all, you would need reliable surveillance data so that at least people knew which drugs worked and which didn't. But then you would need surveillance data, and it have to be available widely. You'd need reliable information and guidance on when to take antibiotics and what works and when, both for the general public and for people supplying them. You'd need to ensure that the antibiotics are not counterfeit, so they're good quality, and they're available at an affordable price. Otherwise, people will just not accept limitation. You need to develop new diagnostic technologies and ensure access to them. And I think in looking at it, you can see there's a mix of technological innovation needed and social innovation. You need to test and take to scale appropriate models for organizing the provision of appropriate treatment of infectious diseases. It may be simply through the standard health system, or there may be special packages to at least make sure that this right is met, but with recognition of the problems. You need to empower communities to make informed decisions. People have to know the situation and have to be involved, certainly in a decision to limit use of those drugs. And then you need to build coalitions with all relevant actors to actually translate good ideas and an obvious recognition as a problem into something that works. And yes, after the first session we had here, employ a learning approach to change management. However we think we're going to make it happen, we're going to be wrong. And so we have to learn how to do it. And I think that's my last slide. Yeah. I think the point here, and this I put here for ESRC, but it's for the STEP Center. I think we have to find some problems that are major problems that can be tackled at scale, but that are manageable. And I guess the question is this one of them for a reasonably short-term perspective? And I guess that's the question for this session.